the Community-Based Health Program, or the CBHP, under the Baranganic approach. My video presentation will showcase information about the Baranganic approach, which answers the following question. What is a Baranganic approach? How the CO process is done, when and why is it used, including who are the specific targeted groups or clientele, and lastly, an uploaded video clip will wrap up my presentation. Thank you.
Baranganic approach.
What is a Baranganic approach? Based on my definition that I have given, it is an approach on community organizing and an enabling method wherein the existing barangay structure is being developed. Why enabling method? It is enabling method because the method or the approach cannot just stand on its own. There is a need of collaboration between the members of the barangay, those families involved, as well as the barangay leaders, the barangay captain, the barangay council as a whole, or if the barangay has facilities or establishments, those people who are working within that establishments and facilities, they are part of the barangay structure. They are part of that community, so they have to work with each other collaboratively. Now, this barangay structure is being developed so that the people will be able to identify, analyze, and prioritize their community needs, aspirations, and problems. So it is very personal to them. Being part of the barangay, you know what you need, you know the issues. So in this kind of approach, all of them will be gathered, they will be developed in order for them to formulate their plans so that they can solve whatever be their problems, issues, or if they have the target that they want, they can actually motivate themselves to achieve the goal or the targets that they have within the community. And it is designed to be comprehensive and integrative of all efforts in the community. Why comprehensive and why integrative? When we say comprehensive, it is complete. When we say integrative, there is unity among separate people. The opposite of integration is separate or differentiate, means to set apart. So when we say integrative, there is actually putting together different people as one so that they can work together. So comprehensive, inclusive, complete, and integrative. Making maximum use of their internal resources. So we are talking about within the barangay, what they have. So of course, people within that barangay, people living in the barangay know what they have, what the resources are, available within them. So this is where the Baranganic approach is very essential within this kind of structure, the barangay. Before I'm going to continue in discussing about the Baranganic approach, I will first introduce to you the Barangay Development Council. This Barangay Development Council, or the BDC, is composed of the Punong Barangay, the members of the Sangguniang Barangay, representatives from the private sectors, NGOs, and other government agencies working or operating within the barangay. These people work together in order for them to formulate a barangay comprehensive and integrative development plan. Going back to the Baranganic approach, another hallmark of this approach is the method of how the members of the BDC are being trained in the barangay development planning. The approach or the method used is actually experiential learning method rather than learning type seminar. This experiential learning method is done through group dynamics, game exercises, as well as workshops. Now, why experiential learning method and not lecture type seminar? As we all know, in experiential learning method, it is more there is more participation within the people involved. They have to speak up whatever they have been through or they are experiencing. They have to express, they have to share their experiences. So it is more personal to them. There is more collaboration, there is more participation. They are being heard by the members of the Barangay Development Council, and it is more participative in nature. Whereas in lecture type seminars, it is somewhat like boring. I am not saying that this kind of seminar wherein lectures are being conducted are not efficient, because there are really approaches where lectures are very important, especially in giving them knowledge, in giving them the bigger picture, in allowing them to understand things. There are times that these lecture type seminars are very important. But in this kind of approach, it is different, because in a Baranganic approach, it is more on the needs, aspirations, problems of the community. They have to analyze, they have to prioritize their needs. So in order for the Barangay Development Council to know those needs, aspirations, and problems within the community, they have to ask them. So in this kind of approach, it is more interactive. The goals of the Baranganic approach. The main target or the goal of this kind of approach is to develop the people's capacity in decision-making, problem-solving, and planning with the help of the Barangay Development Council. The roles of the community development workers here are to assist and to guide the BDC in identifying the problems, the needs, and aspirations of the community. And it is now the people within the barangay who are tasked to formulate a plan on their own, to do decision making and to do problem solving, so that they can implement it and as well as evaluate it after. This is to ensure that these people are the one creating the solutions. So in this kind of Baranganic approach, the people here are the one planning things for themselves. For the objectives of the Baranganic approach, I have here 4. First is to assist the barangay in data gathering. These baseline data will be used in formulating a comprehensive and integrated barangay development plan. Now, what are these information that is needed in order for the community development workers assist the BDC in formulating the plan? These information are, or these data are geographic data, demographic data, economic data, and social data. It is also important to include the political conditions of the barangay. Now, once these information or the data are already present or gathered, the community development workers will now assist the BDC in analyzing these gathered data in order for them to formulate a realistic, comprehensive, and integrated barangay development plan. Now, once the plan is being formulated, it is very important for the community development workers to encourage the BDC to implement this plan so that this will become viable, feasible structure in bringing about desirable change within the community. Another important objective also of the Baranganic approach is to strengthen indigenous leadership through training and preparing them in leading the people to transform the barangay into a self-reliant and self-propelling community characterized by people participating actively in the whole process of barangay development. Now, why indigenous leadership? These indigenous people living within the community are natives within the community. They know the community by heart. They know their barangay from the very beginning, from way back years ago, because they are living there for so long. So it is very important to strengthen these indigenous leaders in the community. For the Baranganic approach process, there are 8 steps under this kind of approach. First, gathering baseline data and making the community profile, which is done through survey and research work. After the data has been gathered and we have already, or the community development workers have already created a community profile, these data should be classified into table forms. This is to ensure easy comprehension. And once the data are into table forms, these are to be submitted to the Barangay Development Council for analysis. Once the data has been analyzed by the BDC with the help of the community development workers, there is what we call the 4th step, which is prioritization of problems. It is very important to prioritize the problems, those problems that need urgent solutions, so that the Barangay Development Council can now formulate a plan, a comprehensive and integrated development plan for the barangay. After that, there is what we call the presentation of plan to the Barangay Assembly, because now it is the Barangay Assembly who will approve, who will adopt, or who will amend that particular plan. After that, then it's now in the implementation process. So once it is being implemented, the final approval by the different committees through people's participation, then we will go to the next step, which is the evaluation of the plan through council meetings and spot site visitations of projects and services. Once the evaluation is done, then replanning is the last step. This can be done every 6 months or once a year to include and accomplish plans. So these are the 8 steps of the Baranganic approach process.
Community-driven development, CDD. Community-driven development, CDD, has become an increasingly common tool used by governments to address the needs of poor communities. The CDD approach is characterized by the movement of responsibility over resources and planning decisions to local decision makers in an effort to more accurately and efficiently identify the needs on the ground. Empowering communities to take charge of their own development may also lead to long-term effects on how they perceive their own role in governance, with improvements in accountability, transparency, and the quality of decisions.
Community-based health program, CBHP. It is an approach to the community in response to the identified health needs of the people. health education on prevention of diseases, health skills training, patient referral network, livelihood trainings, patient database and information dissemination, resource generation and knowledge sharing, partnership building. It encourages and enhances health and wellness in the community.
I have researched 4 community-based health program strategies. First is organizing and networking. Once you organize a community, once there is a networking, that means dealing with other people, influencing other people within the community, then it is actually a style, a strategy under the community-based health program. Another strategy is advocacy and public information. When you advocate a specific cause, a specific policy that you recommend, that you believe that this is helpful to the community, then you are having this kind of strategy wherein you are advocating, you are giving the public information regarding this particular policy or program or plan that, or any cause that you believe that which is helpful to the community. Another strategy is education and training. So it is very important also to educate people, to train them to be part of the community-based health program. Aside from the education and training, we also have provision of basic health services. Now, what are the provisions of the basic health services? How are these basic health services being delivered to the community, to the people, so that they can be benefited by this kind of basic health services? So it is also a strategy under the community-based health program.
Example: a simple mobile paramedic training team to a nationwide formation which lays down the foundation for an alternative healthcare system which is nurtured, developed and defined by the people in the communities as their own health program. Continuing impacts of CBHP: empowers communities, local government units and key stakeholders toward good governance for health. Generates local government unit and community commitment to manage and sustain healthcare. Strengthens multi-sectoral linkages. Improves access and provision of health services to GIDAs, geographically isolated and disadvantaged areas.
Before this video ends, allow me to share a video clip about the Kalahi CIDSS, or the Kapit Bisig Laban sa Kahirapan Comprehensive and Integrated Delivery of Social Services, as this was expounded by Social Welfare and Development Secretary Dinky Soliman in her interview with ANC. Please watch this.
Tell us what Kalahi CIDSS is all about.
It is a program that basically seeks to empower people to be part of the development process. Now, what does that mean? It really means that they are participating from the very beginning of analyzing their situation, which we call the participatory situational analysis. That's the whole community engaged in a process of identifying what are the key problems that beset them, what are the resources that they have, what kind of projects will be turnkey that will help them address these identified problems. And then from there, they make a proposal which then goes through a process of vetting among themselves at the municipal level. Each of the barangay has at least 3 people who will represent them, not necessarily the elected official. It would be those who were part of that process, and then they vote. Each barangay presents the project that will address what they think are problems that are key to their community, and there is an indicative planning figure that they know before this whole process starts, and the people vote on what projects should be funded by this indicative budget.
From your experience and observing how the program has been working or being carried out, are there some surprises by way of very, very common individuals? You said that those that spearhead the efforts may not necessarily be the elected officials. They may be barangay leaders who are not elected officials. But have you seen people just really come forward and say, this is what we need, from the most unexpected of places?
Yes, actually, because you create the community, create the opportunity for the community to hear their voice, to be participating, because the assemblies must have at least 80% attendance of the whole barangay. Different suggestions and different kinds of leadership emerge, especially that of women. For example, you have the women in Ahoy who were very instrumental in pushing and finishing the seawall in that municipality as a major program done by community-driven development process. And because of that, they prevented the storm surge to really go into the town and really save lives. So that, I think, are very curious projects where women are the ones pushing, when you would think that engineers and men would normally want to do that. The other project that comes to mind is what we were calling the Gagamba Boys. Again, women were the ones who were pushing this because it's their children. This is in I want to get that straight.
All right, the showcase community.
Makatungo in Concepcion, Iloilo. And this place where the boys and the children would climb down and climb up the hill to go to school because there was no access road going up to their barangay. And so again, the people were the ones who pushed that an access road be made, and it has been made through the CDD approach. So now instead of clambering up and down the hill, they walk into an access road now that actually can also bring in a 2 to 3 wheel drive kind of vehicle.
Okay, after having said what you've said so far this morning, you pretty much seem to have defined what community-driven development is. That's CDD. Anything more to add about how community-driven development works?
Well, I think the other one is that because community-driven development involves people and they know that the sub-projects that they create will be used by their own children, will be used by them, they make sure that the standards are met of buildings, infrastructures, if not a little over. Because, you know, in the Yolanda areas before Yolanda came in Leyte, Samar in particular, we had about 1,531 substructures. So these are daycare centers, classrooms, health units that were repaired, access roads. Of the 1,531, 377 had some partial damage, cracks and all of that, kind of minor damages, and 2 were totally damaged. The rest were still standing.
So
after
majority
Yolanda
stayed standing.
Yes, and the reason for that is because the standards for infrastructure, for buildings, for the daycare, for the repaired classrooms were followed because they know that if they cheat, they're cheating on themselves. So that's the other feature of this. And of course, there's no corruption so far that has been reported in these types of projects because it is a very transparent, and the people themselves are getting the report on a daily basis because it's a requirement that they post on the barangay hall or a public place the amount of money that has been given, the amount of money that has been used. So there are committees called procurement, there's a monitoring committee, there's a finance committee, there's monitoring and evaluation, and maintenance and operation committee. So it's really spread out, and it's very hard when 2 or 3 people are the ones deciding about the money. That's when you can actually connive and benefit from it. But if you know there are about 50 to 100 people knowing that this is what is the money and this is where it's going to go, it's very hard to connive.
All right.
Anyway, if you connive, you only get 1 peso each.
All right.
It's not worth it.
Speaking of the money, how is Kalahi CIDSS funded mostly?
This is mostly funded by government, but it's also supported by World Bank and Asian Development Bank, especially for this round where we call it the National Community-Driven Development Program. It has expanded. You see, the beginning of Kalahi Seeds was comprehensive integrated delivery of social services during the time of President Ramos. And during the time of President Arroyo, when I came in for my first tour of duty, we expanded that and enhanced it by making sure that the money now goes directly to a sub-project account, which is done by 3 of the people who are implementing the sub-projects and the barangay the barangay treasurer who is bonded. Now, that feature, I think, made the projects then more owned by the people, because they were the ones not only who identified and implemented, but managed the money themselves.
Are these bank accounts typically domiciled in one particular bank? Is it a private bank or is it a government bank?
It's a bank of their choice, whatever is accessible to them by way of the place, because most of these places are geographically isolated and disadvantaged areas. So the bank that is nearest to them in the municipality would be the bank that they would use. So it's either a rural bank, a cooperative rural bank, or if land bank and or any other private banks is present, then they use it.
Interestingly, Secretary Dinky, this strategy is actually embodied in the local government code. Why then do we need a separate entity to push this initiative? Why can't the local governments just implement the strategy?
Because we have a very uneven quality of local government unit leadership. I think it's quite obvious for many of us that depending on the local chief executive, you can have a very transparent and accountable governance, and we have seen that in the Kalahi Seeds experience. But you can also have a very authoritarian type of governance where only a few people, including the mayor, know what's going on, especially about the money. And that's when the corruption practices come in.
Okay, we're walking into interesting territory here. How do you keep the politics out? Because absent this kind of initiative or this kind of program, then people who are displaced after a calamity or have difficulty accessing basic services, their go-to person will be perhaps the people they know in local government, starting with their barangay captains and then up the ladder, right? Perhaps this is a way of actually keeping out the whole, shall we say, practice of patronage and dependence of citizens on politicians to help them in these times of crises.
It's actually strengthening our democracy. It is, in fact, yes, cutting down on the patron-client relationship and transforming that into a governed and governance type of relationship, which means I ceded my power to you by voting you into office so that you will manage the resources of government to our benefit. Now, this process makes the people see that, hey, wait a minute, you have to tell us where did that money go, the development fund, because that could be used as a counterpart for our project. By the way, we have this much money that can be made into an access road. If you can give us this amount, we both have a beneficial road that is accessible. We will thank you for your counterpart, but it was also us who did it. So it's really strengthening the citizens' right to hold government accountable. And the beauty of this is that they can hold them accountable because they don't depend on the money to be given out by the local government unit or the local chief executive. The money is in their hands because it goes direct to a community account, and therefore that's part of the power that they wield now. Whereas before, they have nothing. They have to really bow and kowtow and say, oh, come on, we really need this. It really is going to kill our children if you don't build the bridge, or it will make our children slide down if we don't have the access road from the hill. But now they'll say, we have this much money. We have 2 million. We just need another 500,000. And we know that you have money from the local development fund. Let's collaborate on this. So it changes the relationship of the local chief executive and the citizens. It becomes the active citizenry engaging local government to be responsive to their needs.
If this continues to work well, I think we have a revolutionary concept on our hands.
Well, it's been going on for more than 9 years, and we have very, very good local government units, from mayors to governors, who have used this process. And in fact, in the last impact evaluation of World Bank, 75% of LGUs are supporting this process because they see that it really makes the projects very responsive to the needs of the people, and they get re-elected for so little. They don't have to spend too much because people believe that with this kind of leadership, we will prosper because they see it so concretely. The roads are there.
Right. Again, in line with my